All I know about childhood cancer is that a definite cure has not yet been found, and this program that they are hosting is a really big help. Is giving us more awareness.
The World Health Organization says an estimated 400,000 children worldwide develop cancer every year. In Nigeria, awareness of childhood cancer is very low, with reports showing that childhood cancers are more in rural areas. At this symposium, to mark the day, health experts are calling for more awareness within Nigeria.
We know that most cases of cancer present late. About 75% of cases of cancer, when diagnosed in children, they are already advanced. And then there is also poor access to treatment. And there is also abandonment of treatment. Patients begin to treat, parents begin to treat. Suddenly they cannot afford it anymore and they opt to go elsewhere.
The big challenge that we have in Nigeria is that cancer is one of the few things that people think that can possibly happen to a child. And it's not necessarily a bad thing, because people don't want to think that such a terrible disease can happen to a child. But the reality is that we have to have the suspicion of it.
Others called for early vaccination and accessibility to cancer care amongst children. Some say children are the most vulnerable population in any country and the future of the nation. The federal government is now calling for funding of non-communicable diseases like cancers among children, highlighting steps being taken to address this.
There's the involvement of pediatric cancers and childhood cancers in the plan, which hitherto was not among the list of cancers that were covered. Previously, adult cancers were the only ones that were covered, but right now, in the new strategic plan, that's the first thing. The second thing is that there's a collaboration between both the international groups and also the local groups.
In this year budget that we are still working in, the Cancer Funds is receiving very serious attention.
I think that one of the topmost things that I have noticed, especially in my interaction with families and medical personnel, is this issue of blood. Being able to access blood in the hospitals. The process, the procedure, the government should really look into it.
Early vaccination and awareness is now being canvassed to address the advancement of cancers in children.
I will let them know of the dangers of not getting vaccinated at an early stage to prevent childhood cancer. I will let them know of the advantage of what I learned here and how they can apply it on their daily lives.
Olije Wapera, Arise News.